GRALISE gabapentin tablets use an innovative gastroretentive patented polymer technology to optimize drug delivery to the upper small intestine, particularly the duodenum, which is the primary site of gabapentin absorption. Upon contact with gastric fluid, GRALISE quickly swells to a size larger than the open pyloric sphincter, allowing it to be retained in the stomach for a period of time following ingestion. Once retained in the stomach, GRALISE gradually releases a controlled amount of the active ingredient, gabapentin, to the site of optimal absorption, the upper small intestine. In the small intestine, gabapentin absorption is mediated by a saturable transport mechanism. These transporters can be overwhelmed with large volumes of drugs, which may limit bioavailability. GRALISE slowly delivers gabapentin over time to the site of optimal absorption, thus minimizing transporter saturation. Patented polymer technology allows the gradual, controlled release of gabapentin in order to maximize drug absorption, optimize bioavailability, and allow once-daily dosing. Pharmacokinetic studies show that optimal exposure is achieved when taking GRALISE once daily with a high-fat evening meal. Plasma levels peak during the night and are maintained above baseline for 24 hours. GRALISE, a gastroretentive patented polymer technology designed for once-daily dosing.
Indications and usage. GRALISE, gabapentin, is indicated for the management of post-herpetic neuralgia, PHN. GRALISE is not interchangeable with other gabapentin products because of differing pharmacokinetic profiles that affect the frequency of administration. Important safety information. Contraindications. GRALISE is contraindicated in patients who have demonstrated hypersensitivity to the drug or its ingredients. Warnings and precautions. The safety and efficacy of GRALISE in patients with epilepsy have not been studied. Suicidal behavior and ideation. Anti-epileptic drugs, AEDs, including gabapentin, the active ingredient in GRALISE, increase the risk of suicidal thoughts or behavior in patients taking these drugs for any indication. Patients treated with any AED for any indication should be monitored for the emergence or worsening of depression, suicidal thoughts or behavior, and/or any unusual changes in mood or behavior. Respiratory depression. Gabapentin has been associated with serious, life-threatening, or fatal respiratory depression when co-administered with central nervous system (CNS) depressants, including opioids, or when there is an underlying respiratory impairment. When the decision is made to co-prescribe GRALISE with another CNS depressant, particularly an opioid, or to prescribe GRALISE to patients with underlying respiratory impairment, monitor patients for symptoms of respiratory depression and sedation and consider initiating GRALISE at a low dose. Withdrawal of gabapentin. Gabapentin should be withdrawn gradually. If GRALISE is discontinued, this should be done gradually over a minimum of 1 week or longer at the discretion of the prescriber. Tumerogenic potential. In standard preclinical in vivo lifetime carcinogenicity studies, an unexpectedly high incidence of pancreatic acinar adenocarcinomas was identified in male but not female rats. The clinical significance of this finding is unknown. Drug reaction with eosinophilia and systemic symptoms, DRESS/multi-organ hypersensitivity. Drug reaction with eosinophilia and systemic symptoms, DRESS, also known as multi-organ hypersensitivity, has been reported in patients taking anti-epileptic drugs, including GRALISE. Some of these events have been fatal or life-threatening. DRESS typically, although not exclusively, presents with fever, rash, and/or lymphadenopathy in association with other organ system involvement, such as hepatitis, nephritis, hematological abnormalities, myocarditis, or myositis, sometimes resembling an acute viral infection. If such signs or symptoms are present, the patient should be evaluated immediately. Adverse reactions. In clinical trials, the most common adverse reactions were dizziness, 10.9%, and somnolence, 4.5%. Across all GRALISE clinical trials, the other most common adverse reactions, greater than or equal to 2%, were headache, peripheral edema, diarrhea, dry mouth, and nasopharyngitis. The types and incidence of adverse events were similar across age groups, except for peripheral edema, which tended to increase in incidence with age. Drug interactions. An increase in gabapentin AUC values has been reported when administered with hydrocodone or morphine. It is recommended that GRALISE be taken at least 2 hours following antacid administration. Use in specific populations. Pregnancy Category C. GRALISE should be used during pregnancy or in women who are nursing only if the benefits clearly outweigh the risks. Pediatric use. The safety and effectiveness of GRALISE in the management of post-herpetic neuralgia in patients less than 18 years of age have not been studied. Geriatric use. The total number of patients treated with GRALISE in controlled clinical trials in patients with post-herpetic neuralgia was 359, of which 63% were 65 years of age or older. The types and incidence of adverse events were similar across age groups, except for peripheral edema, which tended to increase in incidence with age. Hepatic impairment. Because gabapentin is not metabolized, studies have not been conducted in patients with hepatic impairment. Renal impairment. Dosage adjustment of GRALISE is necessary in patients with impaired renal function. GRALISE should not be administered in patients with creatinine clearance less than 30 milliliters per minute or in patients undergoing hemodialysis. Reductions in GRALISE dose should be made in patients with age-related compromised renal function. Overdosage. Acute oral overdoses of gabapentin have been reported. Symptoms include double vision, tremor, slurred speech, drowsiness, altered mental status, dizziness, lethargy, and diarrhea. Fatal respiratory depression has been reported with gabapentin overdose, alone and in combination with other CNS depressants. Please see the full prescribing information, including medication guide.